Peripheral arterial disease, or PAD, is a common circulatory problem caused by blockages in arteries of the legs. These blockages are due to plaque formation from accumulation of cholesterol and other scar material. This is commonly referred to as hardening of the arteries. PAD can often be asymptomatic or present as leg pain brought on by walking, discoloration of the lower extremities, or more rarely, non-healing ulcers and gangrene. PAD is a very common condition estimated to affect over 10 million Americans, most of them over the age of 50. It affects 12% of the population over the age of 65. PAD can be a signal of disease in the circulatory system elsewhere in the body, including the kidneys, great vessels, and the carotid arteries supplying blood to the brain. Patients with PAD have a 50% likelihood of having blockages in the heart arteries. Risk factors for PAD include diabetes, high blood pressure, history of smoking, and elevated cholesterol. The most common symptoms are pain, dullness, and cramping or fullness in the legs after walking a certain distance. This is called claudication. Other signs and symptoms include discoloration, numbness or tingling, a non-healing sore, and/or loss of hair on the involved leg. A sensation of coldness or even gangrene can occur in its late stages. PAD is readily diagnosed by non-invasive testing in your doctor's office. An ankle brachial measurement, ABI, is a simple test that compares the blood pressure in the arm and the legs. An abnormal ratio of the leg pressure to the arms indicates PAD. Additional information can be obtained non-invasively with a CT or MRI scan, or invasively via angiography with dye-based studies that can accurately define the site and extent of blockages in the leg arteries. Information obtained from such studies can then be used to develop a treatment strategy for each individual patient. Exercise therapy involving regular walking for 30 minutes at least 3 to 5 times a week can be a very effective means of reducing symptoms and actually increases the time before onset of pain. For best results, one should walk till claudication occurs and slowly try to increase the distance before you stop. That is, working through the pain. Ways to reduce the risk for PAD include smoking cessation, strict control of diabetes, high blood pressure, and high cholesterol reduction, as well as improvement in diet and weight loss. Non-surgical procedures such as angioplasty, stent insertion, atherectomy, and laser therapy can improve blood flow to the involved arteries. These procedures are performed through a small hole in the leg artery using X-ray contrast and fluoroscopy. Various surgical techniques exist to create bypasses to supply blood beyond the area of the blockage. A piece of vein harvested from the legs or synthetic artery can be used to create these bypass grafts. 2 medications have also been approved by the FDA for treatment of PAD. These are Platol, which reduces clotting particles, and Trental, which reduces blood thickness. Prevention of PAD is very similar to prevention of blockages in other arterial beds. Good nutrition and low-fat diet, control of diabetes, high blood pressure, and cholesterol reduction, and maintaining an optimal weight reduce the chances of developing significant PAD.